My name is Mark Goldstein. I'm Fairfield. Change the subject a minute. More ubiquitous question. I'm trying to understand how you, and I use the term you to mean Congress in general, approach problems. And I come from a business background, and one of the things I was impressed by you was you had a business background. I just want to focus on healthcare for a minute. You mentioned bringing down the cost of healthcare, okay? As a businessman, when I look at a problem, bringing down cost, one of the things I look at, what are the cost drivers? What is costing us to spend all this money and getting very little in return? For example, from what I've read, we spend the most per capita on healthcare, and I think our outcomes rank us about number 17 in the world. Getting our bang from a buck just isn't there. I went around and I spoke to a number of people that are in health. I have some friends that are doctors, and right now I'm kind of working in the allied health field. I'd like to work, but my 401k got wiped out, and 70 years old, I had to go back to work. But what these people tell me is that Obamacare, the Affordable Health Care Act, doesn't do it. What we've got to focus on is the cost drivers. What are the cost drivers? Our delivery system stinks, okay, to put it bluntly. I'm going to give you two examples. I had one doctor tell me they're on call one day, okay, and they get a call from a patient who was in the emergency room. Come on down. They came on down, spoke to the patient. If the patient had called them, okay, it would have taken a 5-minute phone call and a $10 generic prescription to get the problem fixed. Patient didn't do that. They went to the emergency room. Husky's paying that. Husky is being billed $1,000 for the emergency room visit. Doctor says to the patient, I spoke to you, do not come into the emergency room, okay? It's costing too much money. Patient's comment was, well, I don't care, okay, I'm not paying for it. The government up there, somebody else is paying for it. I got a minute left? Okay, half a minute left. The thing that question I've got is, as a businessman, I stand back and I say, hey, this whole thing is missing the point. We're not focusing on the drivers of healthcare, the cost drivers. I mean, I don't understand why. It seems that what things go about it is just plain crazy.
Yeah, thank you for your comment. You put your finger on a key issue. And look, you talked a little bit about Obamacare. Obamacare had a mechanism to provide subsidy for people who couldn't buy health insurance. It's going to require people to buy health insurance. It's going to close the donut hole for our seniors. It's a whole bunch of stuff.
My insurance company tells me my premiums are going up.
Well, they've been going up for years. But you put your finger on something that you can, I think, very fairly criticize the healthcare reform, which is it didn't go nearly far enough on getting at the fundamental cost drivers of healthcare inflation. Which are, there's a ton of them. The gentleman, sorry, I forgot you. Mark is exactly right. We spend 2 times per person what every other industrialized country spends on healthcare, and we get worse results in the aggregate. That's the definition of inefficiency. Why? Because there's a lot of reasons. But number one is, think about how providers are paid for healthcare. They get paid for doing lots of stuff. Every x-ray, every pill, every hospital stay, every consultation is more money. And it's not that providers are bad people, they're not, but there's a natural incentive to do a lot of stuff. Then you've got defensive medicine that doctors are pricing. You've got uncompetitive mechanisms. Right now, medical devices, from oxygen tanks to wheelchairs, Medicare does not require competitive bidding for those things. If you've got competitive bidding for medical devices, I could go on around things that we need to do.
That's my question.
Yeah.
Congressman, well, when they look at healthcare, you know what the problem is and what the cost drivers are. Why can't you address it? Why can't anybody address it?
Well, we will. We will. But so what's the back to the weird nature of our politics? Guess who doesn't like the idea of competitive bidding for medical devices? It will not shock you to know that the medical device companies are desperate.
But there's more of us folks than there are medical devices.
I'm not excusing them. I'm just telling you kind of the dynamic. By the way, the other thing I want to mention really quickly, and I appreciate you bringing up what I think is really the key point. I want to mention 2 other things. One, there is a whole area here that we should be talking about in addition to the delivery model, which is promoting wellness, right? Our whole system in healthcare is designed to fix you when you're broken, to get you better when you're ill. Nobody gets paid to address the obesity problems in this country, to get people to stop smoking, to get people to stop drinking. If we do that, that's by the way, one of the win-wins. You know, medical devices, that's somebody's lunch, the uncompetitive bidding. we get fewer people, you know, with type 2 diabetes or chronic diseases and whatnot. We've got a win-win. So all that stuff has got to be the focus of the next couple of years. And by the way, and I want to be very careful about how I say this because I'm not going to try to sell you on something that's not true. For the first time in decades, healthcare inflation has been remarkably low in the last 3 years. The economists don't quite know how to explain that. It is in the interest of some people to say that some of the mechanisms in Obamacare are responsible for that, but we are also in the midst of a very severe recession. So I'm being very careful in how I tell you about that because it's some combination thereof. But thank you for raising that. This is, I think, the key fiscal issue that we face.